How does multifocal disease affect transitional cell carcinoma? Imagine a cancer that can appear in multiple spots within the urinary tract at the same time. That's what happens with multifocal disease in transitional cell carcinoma, also called urothelial carcinoma. This type of cancer often shows up in the renal pelvis, ureters, or bladder, and in about 30 to 40% of cases, multiple tumors are found when diagnosed. Having more than one tumor at once makes the disease more complex and often more serious. When cancer is multifocal, it tends to be more aggressive. This means it can grow faster and is more likely to come back after treatment. Doctors see that patients with multifocal transitional cell carcinoma are at a higher risk of the cancer progressing or recurring, which is why they usually recommend close and ongoing monitoring. Because the disease can be more widespread, treatment plans might need to be more extensive, and follow-up visits more frequent to catch any new tumors early. Research shows that patients with multifocal disease in the upper urinary tract, like the renal pelvis or ureters, have a much higher chance, up to 3 times more, of dying from their cancer compared to those with just a single tumor. This makes multifocality an important factor in predicting how well a patient might do over time. It also influences how doctors decide on the best approach for treatment and follow-up care. The reason why multifocal disease tends to be worse is still being studied, but it may be because the cancer cells have a more aggressive nature or because the disease is caught later. Sometimes, the presence of multiple tumors reflects a field change, where the entire lining of the urinary tract has been affected by carcinogenic changes, leading to multiple tumor sites developing over time. Multifocal transitional cell carcinoma often involves several parts of the urinary system, like the renal pelvis, ureters, and bladder. It's common for patients with upper tract tumors to later develop bladder cancer, with about 40% experiencing this recurrence. This pattern shows how interconnected these tumors are within the urothelial lining. Overall, multifocal disease in transitional cell carcinoma signals a more serious and widespread form of cancer. It underscores the importance of thorough diagnosis, aggressive treatment when needed, and vigilant long-term follow-up. If you or someone you know is dealing with this condition, it's essential to work closely with healthcare professionals who can tailor the best plan for managing the disease and protecting kidney health. Always remember, each person's situation is unique, and medical advice should come from qualified healthcare providers.